Lung cancer refers to malignant tumors in the lungs that can occur in the lungs themselves, primary lung cancer, or other organs, e.g., lung metastasis of breast cancer. The types of primary lung cancer are classified into non-small cell lung cancer and small cell lung cancer according to the size and shape of cancer cells. Of lung cancer, 80 to 85% are non-small cell lung cancer, which is again classified into adenocarcinoma, sample cancer, squamous cell cancer, and large cell cancer. The remaining small cell lung cancer is generally highly malignant, and at the time of discovery, it has already spread to other organs, opposite lungs and longitudinal heart organs, esophagus, aorta, etc., through lymph vessels or blood vessels. Non-small cell cancer, which accounts for 80 to 85% of lung cancer, is again divided into squamous epithelial cell cancer, adenocarcinoma, large cell cancer, glandular squamous cell cancer, sarcoma cancer, calcinoid tumor, salivary gland cancer, and undifferentiated cancer. Each of these cancers is further subdivided according to morphological characteristics, such as the shape and arrangement of tumor cells, for example, adenocarcinoma, papillary adenocarcinoma, bronchial alveolar carcinoma, and mucus-forming faithful adenocarcinoma. The distinction between non-small cell cancer and small cell cancer is because clinical progress and treatment are different. Non-small cell cancer can be diagnosed early and cured by surgical treatment. On the other hand, most small cell cancers are often progressed to the point where surgical resection is difficult at the time of diagnosis and grow rapidly and become systemic metastasis. But it responds well to chemotherapy and radiation therapy. Non-small cell lung cancer. Squamous cell carcinoma of epithelial cell. This cancer is caused by denaturation of the squamous epithelial cells that make up the bronchial mucosa of the lungs. Flat epithelium is a generic term for epithelium, with a thin, flat shape, and epithelium refers to the cell layer on the outer surface of the body cavity space between the body wall and the gut, and the inner surface of the gastrointestinal tract. Squamous cell carcinoma is found mainly in the heart of the lungs, common in men and associated with smoking. The main symptoms, such as coughing, hemoptysis, and wheezing breathing, appear mainly because the tumor blocks the bronchial tubes. Adenocarcinoma. Adenocarcinoma refers to cancer that occurs in the body's gland cells, which enable the secretion of certain substances. Lung adenocarcinoma is the most common type of lung cancer. It is good looking in the lung peripheral area, gets caught by women or people who do not smoke, and is often metastasized even if it is small. In recent years, the incidence has been on the rise, which seems to be related to changes in the amount of tar contained in cigarettes, smoking habits, smoking volume, dietary changes, and environmental and working factors. Since adenocarcinoma occurs mainly at the distal end of the bronchial tubes, simple chest X-ray also shows sclerosing findings, such as small lung nodules or pneumonia. Smoking is the most important cause of lung cancer. About 7,000 harmful substances are found in cigarettes, of which more than 60 are known as carcinogens. Smoking increases the risk of lung cancer by 15 to 80 times compared to those who do not. The correlation between smoking and lung cancer increases as the amount of smoking increases, the earlier you start smoking and the longer you smoke. It is also related to the form of smoking, so the risk varies depending on the depth of inhalation of cigarette smoke. The possibility of lung cancer increases in proportion to the amount and duration of smoking, and the risk of lung cancer is so slow even after quitting smoking that the risk of lung cancer is higher than that of non-smokers for up to 20 years, so smoking cessation is better as early as possible. Here's how to increase the success rate of quitting smoking.